The NIDDK is hosting a multi-part data management and sharing webinar series to provide education and outreach to the NIDDK scientific community, especially about topics in data management and sharing. Housekeeping-wise, I have a couple of announcements. This webinar will be recorded and the materials will be shared afterwards with all participants via email. The chat is turned off for today, and we ask that everyone submit their questions in the Q&A for our panelist Q&A session at the end of the webinar today. If you have any technical issues at any time, please do put a question in the Q&A and we will have one of our team members here assist you with the technical issues as well. So for today, we present session 1 of the NIDDK DMS webinar series titled Writing a DMS Plan. The aim of today's webinar is to present topics for consideration when developing a DMS plan. The presenters today will highlight resources from NIH, NIH institutes, including NIDDK, and research institutions, which can make the process of writing the plan and the data management that follows much easier. And so as a final reminder, there is a Q&A feature for you to use during the presentations. At the end of all presentations, so at the very end of the hour here, we will bring all of the speakers back to take the questions that have been posed in the Q&A box. Are there any questions or technical issues at this time? If so, please put them in the Q&A. Okay. Well, with that, I will introduce our speakers for today. We have 3 wonderful speakers today ready to present different resources that can help investigators drafting their DMS plans. We have Jaron Stratford. Dr. Jaron Stratford is a bioinformatician and data scientist at RTI International. He specializes in the integration of clinical, environmental, genomic, and transcriptomic datasets to identify disease subpopulation and biomarkers to improve the treatment of human diseases. He is a strong advocate for data sharing and is actively working to create metadata standards, data standards, workflows, tools, and resources to increase data findability and interoperability. Next, we have Dr. Lisa Federer. She is a data science and open science librarian, currently serving as the acting director of the Office of Strategic Initiatives at the National Library of Medicine, or NLM. She works in a number of areas related to advancing data science and making research products more openly available, including development of training resources to help scientists make their work more efficient, more transparent, and reproducible. And finally, we have Arielle Deerdorf, who is the UCSF Data Sciences librarian and a member of the library's data science team. In her role, she teaches classes and provides support for research data management, open science, and reproducibility in the health sciences. She is an expert in research data publishing and has led the library's involvement with several data infrastructure and policy projects. Arielle is also an open science advocate who performs research on the role of the library in enabling open and reproducible research. And so with that, I will pass to our first speaker, Jaron Stratford, who will be giving an overview of data management and sharing.
Yeah, so like Michelle said, my name is Jaron Stratford and I'm a data scientist at RTI International, and a good portion of my career has been involved with secondary data analysis, and so data management and sharing is something that I'm passionate about and a big supporter of, and so I'm excited to talk to you about it today. So next slide. So the NIH policy, when it's been described by the NIH, has often included this phrase, catalyzing a culture shift. And this is really, a critical part of why we are doing this policy, and that typically the data lifecycle or the research lifecycle involves, asking a question, collecting data, analyzing that question, and then reporting our findings. And typically the data sharing has not been a part of reporting the findings. It's typically been publications in journals or presentations at meetings. However, instead of just relocating the data to an available upon request line within a manuscript, having that data available really lends itself to lots of benefits. And so being able to really use this policy to encourage investigators to include data sharing within the life cycle is the intent. Next slide. And as investigators are able to really embrace the data management and sharing, there's a lot of value that comes from it. So maximizing the availability of the data really helps us to increase the validity of research findings in order to test those. So being able to have all that data there, look at the way it was generated, understand it, and reproduce it really helps with the validity of those findings. We can then combine data sets because the data is available. It may allow us to ask questions that previously we weren't able to because the data didn't support it. Being able to generate some data is very costly and time consuming. And so being able to have all researchers have access to the data is of extreme value as we look to analyze that data in new ways, ask new questions of it, and open new frontiers for discovery because of the availability of the data, as well as having data transparency to foster trust with the public so that we can understand why we are doing something and the benefits of doing it. Next slide. So the DMS policy itself applies to all studies that generate scientific data. And the NIH has defined scientific data as the recorded factual material commonly accepted in the scientific community as of sufficient quality to validate and replicate research findings, regardless of whether the data are used to support scholarly publications. So the exact scope of scientific data will vary based on the context, and there's nobody in a better position to define what that scientific data is than the researchers who are proposing to generate it. The NIH has supplied additional guidance and examples of what scientific data is, which is available in the research covered under the DMS policy section of the sharing.nih.gov website. So the policy itself is rather straightforward in that it only has two requirements. The first requirement is that researchers submit a data management and sharing plan. And the second is that once that plan is approved, that the investigators comply with the plan. And of course we know that plans may need to be updated over the course of the award. And as changes to the DMS plan are proposed and approved, we will then comply with those amended and updated plans throughout the course of the award. So we can move forward onto the next slide and talk about what these DMS plans actually consist of. So there's really two parts to the DMS submission. The first is a data management and sharing plan, which describes how the data will be managed and shared, and it will address 6 key elements, which we'll describe here in detail in just a minute. And if you want to advance the slide, the second part of this is the associated costs. So we know that funding that doing data management and sharing activities has associated costs, and it is appropriate to request funding to support those costs. So when we submit the data costs, it will consist of 2 parts. There's the DMS budget and the budget narrative, which provides the justification. Now, unlike the DMS plan, the DMS cost is included in the peer reviewed process, although it does not affect the score. The peer review process is involved with determining whether the requested budget is appropriate to support all of the activities outlined in the DMS plan, which are briefly summarized in that budget narrative. And so we're going to go into greater detail about each of these 2 elements right now. I'm going to go into the next slide. So when the final policy was issued back in October of 2020, the NIH also put out a supplementary policy information describing the elements that should be included in the DMS plan. This was published also on the sharing.nih.gov website, and each of these 6 elements is expected to be included in the plan. The first element that was described is the data type element. So in this element, investigators should provide information about the data types that are proposed to be generated during the project and identify which of all the data types that are generated will be shared. This does not include all of the data that was generated, but should focus on the scientific data that underlies the proposed research findings. Justification should be provided for any data types that are decided not to be shared. We know that the scientific data will vary project by project, and so researchers will need to identify and define, based on their research proposal, what that scientific data and data types look like. Next one. So the next data element is the related tools, software, and code. So this section of the DMS plan is where investigators indicate and provide links for any tools or software or code that is required in order to either view, access, or use the data that is shared. And this is regardless of whether the data was published or not. Next element. So the data standards element is where investigators will describe the common data standards that will be applied to the scientific data and metadata in order to enable the interoperability of the data sets. And we know there are many factors which play into what this looks like, and the exact standards and metadata, including associated documentation, will vary based on the scientific area, the study design, the types of data collected, and the characteristics of that data set. It's likely to include several domains, though, which may include common data elements. It may use ontologies or standardized vocabularies, file formats and structure of the files, as well as included documentation, which may include a study protocol, a data analysis plan, evaluation of quality control metrics, and others. So researchers will need to define this individually based on their plan and based on the factors that go into this. Next element. So the next element is the data preservation, access, and associated timelines. So this element is where the researchers should indicate their plans to preserve the data and to provide access to the shared data, including the timelines. So this includes the name of the proposed repository, or in some cases repositories, where the data will be archived and stored, as well as the study and metadata. This section should also include whether persistent unique identifiers will be available to facilitate the findability and accessibility of the data. It should also indicate when the data will be shared and how long that data will be available. Next element. So the access, distribution, and reuse consideration data element comes next. And this is the element where investigators will list and describe any factors that affect data access, data distribution, or data reuse. Researchers should maximize the appropriate sharing of their scientific data, but it is understood that there are times and circumstances where there may be ethical, legal, or technical factors that limit the extent to which the data can be shared. So these limitations should be clearly described in this section before the data is generated, and that allows for time for the proposed funding institutes to assess whether these are appropriate. Research that involves the sharing of scientific data that is generated from human research participants should indicate whether access to this data will be controlled. And by that, we mean that the data will be made available through the repository only after an approval process. Researchers should outline how the privacy and the confidentiality of human research subjects will be protected. And the final element is the oversight of the data management and sharing. So this is the section where investigators will describe how compliance with the plan will be monitored and managed within their institution, and also who within that institution is responsible for performing this oversight. So many of these data elements have additional information that is provided in the writing a data management and sharing plan. There's examples of specific instances, and these are available at the sharing.nih.gov website. So now that we're a little more familiar about the expected content of what the DMS plan looks like, let's talk a little bit about the structure of the DMS plan. So as we're working on writing the DMS plan and understanding what goes into it, the NIH has provided several resources to help us ensure that we address all 6 of these data elements. It is recommended that DMS plans should be 2 pages or less, and it should include all 6 of the data elements. Now, the NIH has created this optional format page that applicants can use as a template to format the elements of the DMS plan. This template is available in the Writing a Data Management and Sharing section of sharing.nih.gov. And it's divided into various sections to make it easy to address each of the data elements in the plan. It also provides the flexibility that investigators need in order to write a plan that best fits their project. So this this optional format page can be downloaded, and it is a fillable Microsoft Word document. And we strongly encourage investigators to take a look here, as it helps to ensure that each of the data elements gets addressed during the plan. Next slide. So the other component of a DMS submission is the DMS budget. So we know that the budget includes various activities which will be involved in creating and preparing data for submission and for sharing. And the budget itself consists of 2 components. So the first is an actual budget amount. And this will be provided in 2 different areas of the application, depending on whether they're submitting a line item or a modular budget. But this will be the estimated cost, direct costs associated with the DMS activities. And the justification is a half-page document that summarizes the types of data that are going to be generated and shared, the repositories that are proposed to be used, as well as general cost categories. And the NIH has supplied information about these cost categories, yes, including these allowable costs. So some of these categories include curating data, preparing supplementary documentation, as well as metadata, preparing data with standards, as well as the appropriate formats that the repositories require in order to deposit data, as well as managing the data locally before it is deposited within the repository, as well as any sort of fees that are associated with the repositories. NIH has also outlined some unallowable costs that are associated where it is not appropriate to request funding for, and this includes things like infrastructure costs, which, for example, would include like creating any sort of repository to handle the data, or costs that are associated with what would be considered just routine conduct of research. And so the budgets will be included in the DMS submission, and only this portion of the DMS plan will be included for peer review. So the DMS plan itself will not be included in peer review, but just the amount and the budget justification. Next slide. So NIDDK recognizes that investigators are coming here with different levels of experience in their DMS journey. So some researchers are already extremely comfortable and have significant experience in planning how to share their data, while others may be rather new to this practice. And there are many challenges that are associated with this process. NIDDK is committed to this effort and working very hard to make the implementation of this policy as smooth as possible. NIDDK understands that if, and most likely when, issues arise, they want to work with investigators as partners in this process in order to really make it as smooth as possible. And so an attitude of learning as we go and adapting as we learn will help us to overcome these issues and allow investigators to not only submit a quality DMS plan, but to take part in that culture change, to adopt and embrace the data management and sharing principles that will allow us to realize that maximum potential of our scientific data. To facilitate this, the NIDDK has developed a set of expectations and guidance around data management and sharing plans that are to be submitted to the NIDDK for funding. Now, this guidance is not a separate DMS policy, but it is intended to supplement the existing NIH policy and really drive this culture change. Next slide. So the guidance that NIDDK has set up can be found on the NIDDK DMS website. And the link to that website is down here at the bottom of this slide and will be provided afterwards as well. There are guidance that are set up for each of the 6 different data elements, and the website clearly defines those. In general, some of this guidance includes, providing rich and detailed information, making the data as fair as possible, and fair standing for findable, accessible, interoperable, and reusable. Making all custom code and software publicly available, and also having instructive documentation about the appropriate use of that code. Utilizing common data elements, using machine readable formats whenever possible, providing both raw and summary data as appropriate, the use of persistent identifiers, as well as making sure that the data is made available as soon as possible with as few restrictions on access to that data as possible within the appropriate level of data sharing. Next slide. So like I said, NIDDK is really committed to making this implementation as smooth as possible. And we know that, over time, there was a deliberate delay in when the policy was released and when the policy came effective. And that is designed specifically to allow for the creation of an appropriate infrastructure to support this effort. There's been lots of effort to make access to resources to implement this and to develop high quality DMS plans. But we know that moving forward, flexibility is really going to be the key. We've just had the first round of submissions of applications that included the DMS plans. We know that there are certain issues that investigators experienced, and we really want the investigators to reach out to their program officers so the NIDDK becomes aware of what these challenges are and can help meet those needs by developing resources and tools as we move into the future and really embrace this policy. Next slide. So NIDDK has generated the data management and sharing website. And like I mentioned earlier, it does include the NIDDK guidance about writing a DMS plan. But there's a separate side of this website, in which you can see down here on the bottom in those kind of oranges boxes, where it describes the NIDDK tools and examples. And so there are many resources here that if you have not had the opportunity to look at this, I would really encourage you to head over there as soon as possible, as we don't have enough time in this webinar to discuss all of the resources that are there, but we are going to highlight several of those resources moving forward. Next slide. So one of the things that we've worked on is to create a roadmap that leads investigators through the process, kind of from start to finish in their development of the DMS plan, helping investigators understand how their study design and objectives factor into it, whether there are other NIH policies that are appropriate, such as the genomic data policy, being able to identify your data types, appropriate standards, and the repositories that are there. So this kind of overview is designed to help investigators ask the questions that will help them to develop these high quality plans. Next tool. In response to feedback the NIDDK has received, we know that templates and examples are very valuable. And in this case, we've created 4 example plans that span multiple research domains, including basic research, both clinical and genomic research, as well as secondary analysis. So those plans are available as a reference in order to give investigators an idea of what the implementation of the NIH policy as well as the NIDDK guidance would look like. Next tool. There are 2 areas that we know there are a lot of questions from investigators, and one of them is about repository selection. And this is because the list of available repositories is quite expansive. And so being able to determine which repository is the best for your data type is a challenge. And so the NIDDK has created a lot of tools And one specific tool is this repository selection aid, where it encourages investigators to go through a kind of decision tree format to understand the characteristics of their data and the characteristics of the repositories, which will maximize the sharing and the value of that data. Next tool. And the other area that we know investigators have a lot of questions about is the data and the metadata standards. And so in this regard, these standards will vary based on the scientific area and the design, the data collected, and the characteristics of that data set. And so there's not a one-size-fits-all approach that can be prescribed for all of the studies. And so these resources here are designed to let investigators know what common things are available and provide links to areas where they can search for their particular data types in order to understand which standards are available and how best to apply those and make their data the most interoperable as possible. Next slide. So, in summary, as we conclude, we've discussed the data management and sharing plans and the requirements that are there, but we also talked about those, those value adds. As we make our data available, there's a number of those different aspects which really will increase as we make that data available. And we want to embrace that culture change so that we can realize all of these bullet points here that are listed. Next point. We also wanted to make you aware that the NIDDK has released guidance about each of the data elements in order to provide that maximum value and sharing of the data. And that data and those guidance are available within the NIDDK website. And next bullet. And then also on that same web page, there are tools and resources that are developed to support the investigators. And we also want investigators to know they can reach out to their program officers and let us know the struggles that they're having so that we can develop additional tools and resources to support that effort as we drive forward in implementation of the DMS policy. And next slide. So we've talked a lot about the NIDDK resources and website, but there also are a number of different resources that are available at sharing.nih.gov. And we've listed out a number of them here, and we encourage you to review these slides and explore some of these links as you craft your plan. And the next slide as well is additional set of resources there. There's a wealth of information, and the NIDDK DMS webpage and the NIH webpage are designed to be supplementary to each other. Hopefully to have very little repetition, but to provide a lot of the guidance and support, specifically at the NIDDK website that are specific to the investigators applying for NIDDK funding. And next slide. So I would encourage you, if you have any questions about any of the material that we've talked about during this presentation or others, to go ahead and pop that into the question and answer function of the Zoom chat, and we will be sure to answer those questions at the end. And with that, I will hand the time over to Dr. Lisa Federer.
Thank you very much. So I think we will have slides brought up. Or I can share mine if that's easier. Oh, there we go. Okay. So hi, thanks for the invitation and thanks all for joining. So I want to talk a little bit about all that you just heard, how you can get some help with that from resources at your institution, specifically the Research Data Management Librarian. Not all institutions have a Research Data Librarian, but I want to talk a little bit about what librarians can do around research data management and data sharing, and give some examples of what librarians have been doing. And then you'll hear from Ariel, who's going to talk about a specific example of what she's been doing at her institution. Next slide, please. So I think a lot of people, when they think of libraries, have this kind of mental image of, card catalog and books and maybe some journals, but you might be surprised by what librarians can do. Next slide. So I'm not going to go through all of this in a lot of detail, but what you see on the left are the American Library Association core competencies, basically expectations for what librarians should know how to do. And many of those map really well to data science, data management, and data sharing sorts of things. So for example, knowledge of information resources goes into data management and sharing. Things like reference and user services can translate to data literacy and data discovery. Things like administration and management can be collaborations with different campus data groups. So there's quite a lot that librarians bring to the table that maybe traditionally was applied to other types of information, but is certainly applicable to the type of data management and sharing that we're talking about here. Next slide. I also want to mention the Medical Library Association does have a data services specialization, and a number of librarians have completed this specialization since it came out a couple of years ago. And this involves 5 different areas of competencies and what a librarian should know how to do underneath each of those to make sure that they are well-rounded and able to provide assistance to people related to data. Next slide. So this is a little bit of data from a recent study that I did that was looking at what sort of services are libraries offering, and what kind of expertise do librarians have. And you can see that for each of these services that is related to the data management and sharing policy, quite a large number of libraries are offering that service for many of these. Some of the areas are less covered by libraries, so things like informed consent documents and HIPAA and controlled access. But for many of the basic data management and sharing sorts of things, libraries are doing this already or plan to do so within the next year. Next slide. As for the preparedness of individual librarians to take on some of these tasks, librarians were asked how prepared they felt to take on these tasks. And the percentage of librarians that felt very or somewhat prepared, as you can see again, fairly high for some of those tasks related to data management and sharing, a little bit less on, again, some of the informed consent and HIPAA, but quite a few librarians still saying that this is something that they feel prepared to take on. Next slide. So I want to talk now about a couple of specific library activities that are going on in relation to data management and sharing. One is the Data Curation Network. This is a network of libraries and institutional repositories that are working to improve data curation and hopefully to make data more discoverable, as we call it, FAIR, findable, accessible, interoperable, and reusable. Next slide. The way that the Data Curation Network works is that it is this whole network of libraries, and not all of the librarians or individuals necessarily have the unique expertise to deal with a given data set in a specific discipline. So the network provides a pool of curators who have some of this specialized knowledge and have worked with these types of data sets before. So the researcher who brings a data set to the DCN ends up with someone who is familiar with the type of data that they work with and can provide specialized suggestions and input about how to improve the data set that they are going to submit. Next slide. So the curation model that they use here, they have the acronym curated. So this involves things like checking the files, reading the documentation and making sure that it's clear. If there is some lack of clarity, getting additional information from the submitter. Improving the submission and transforming the format in some cases, evaluating to make sure that the data is fair, and then documenting this whole process. So they do some really interesting work, and they also are very active in providing training to increase the pool of curators that are out there. So that may be something that you're interested in. They also, with the training, create these data curation primers that you can refer to that look at different data types. So you might say, I'm working with, MRI data, for example, and they might have a primer that would say, here are some of the things that you should look for and best practices for this data type. Next slide. So I also want to briefly mention the network of the National Library of Medicine, or the NNLM. Some of you may know about NLM, the National Library of Medicine, where we have resources like PubMed and many other databases available. We also have a network of libraries around the country with 7 different regional medical libraries in the different regions that you see highlighted here. And the point of these regional medical libraries is that they're able to get out and engage with their communities and work with the medical and public libraries in their region. Next slide. In addition to the 7 regional medical libraries, NNLM also has a National Center for Data Services, or NCDS, which was formed a couple of years ago now. And they've been doing a lot of work around getting the librarian community ready to provide support for data management and sharing policy. So they have built some resources that might also be interesting for researchers, things like guides and resources for working on data and data management and sharing. They provide a lot of training on data related topics, all of which is free. And they do have a summer internship for graduate students who want to dive a little bit deeper into learning about data librarianship. So there's quite a lot of work going on to prepare the librarian community, as I said, to work with data management and sharing policy types of questions. So I encourage you to go to the library at your institution and see if you have a data librarian and learn a little bit more about what they can do for you. Next slide. And I will also just encourage you to put any questions that you have in the chat, and I will pass it over to Ariel.
Thank you so much, Lisa. So I'm going to wrap up the presentation part of this session today by just talking a little bit about some of the work that we've done locally here at the University of California, San Francisco to implement this policy, and give you hopefully a flavor of some of the things that might be available at your own institution as well. So I'll talk about our UCSF library support for this new policy, some of the projects and things we've been working on. Next slide, please. So in case you're not familiar with UCSF, we are located in San Francisco, California, as the name might give you a hint. And we are a research-intensive, graduate-only health sciences university. So we don't have any undergrads, we don't have any arts or humanities. We're kind of sciences only. And we're also the #1 public recipient of NIH funds. So as you can imagine, anything new that comes out of NIH is a big deal on our campus because it impacts lots and lots of people. So we knew we would need to do some planning for this new policy to make sure we weren't behind when it came out. Next slide. So within the library, I am a member of the library's data science team, and our goal is really to build foundational skills in programming, statistics and bioinformatics, data engineering, and data management. So data management is just one of the things that we do, but it's part of this whole kind of bigger life cycle of working with data. We also serve as a campus hub for education and support for data science. So I'll talk a little bit later about how we interact with lots of different groups on campus, but our goal is really to build these connections for our researchers. And with everything, we're really trying to empower our researchers to do innovative and reproducible data-driven science. So as I mentioned today, I'm going to be focusing on the data management piece of all of this, but this is part of a wider web of services. Next slide. So first, I want to talk a little bit about how we prepared for this policy. As I mentioned, we knew this would have some impacts, so we needed to do a little bit of background work first. Next slide. So some of the implications here locally at UCSF of this new data management and sharing policy. Some of our researchers had been sharing genomic data for a while, but we knew that it would be a new practice for many, many people. And so we were anticipating that there would be lots of questions about how do you find a data repository, what's the right one, as Jared was mentioning, understanding what metadata standards are in general, as well as what might be relevant to their projects. And just in general, some of these questions around preparing data for sharing. And there was also a potential misalignment between this new policy and our local data sharing guidance on campus, which was much more focused on sharing data with industry, sharing data with partners at other institutions, and didn't have a lot of information about how do you share data in repositories. So we wanted to fill that gap. Next slide. So we needed to work behind the scenes to get some of this done. So myself and the library, as well as our partners in the Office of Sponsored Research, got together a stakeholder leadership group consisting of faculty as well as research administrators from across campus. And the goal of this group was really to make sure that we all understood what this policy meant and what the implications would be, and then to really prepare for compliance. So we needed to update our local policies to align with these new NIH requirements. We needed to develop tools, guidance, and then plan a lot of communications and outreach, do a lot of education and training. We knew this was going to be new for lots of people. And as I think Jaron mentioned at the beginning, we started this work about a year ago. We did not have a lot of the details at that time of what this policy was actually going to look like, and we didn't have all the resources at that point. So we knew we were going to have to modify as new things came out from the NIH. Next slide. So the major outcomes of this group, we created new processes for approving de-identified data sharing. This was not really a workflow that we worked out, so now we have that, it's well documented. We've created lots of policy guidance and resources, which I'll talk about in a minute. We've done a lot of outreach and training, and our grants management team wanted to kind of track these new DMS plans, so they created control points for monitoring those as proposals were going in. Next slide. So now I want to turn to actually how are we supporting our researchers here at UCSF. Next slide. So we really focus on, I think, as Lisa was talking about, we try and hit researchers at many points throughout the life cycle of a project. So early on, when they're planning their projects, they're writing their grants, this is when we're having conversations about data management plans. What are those? What needs to go in those? If they're trying to access data, we help them find that data, get access to it. In the middle, when you're in the thick of analyzing your data, collecting it, this is when we're having conversations about data storage. You know, what kind of storage on campus is appropriate for different kinds of data. We talk about organization and versioning. How are you going to keep track of all of this stuff? Do you know how which version is the most recent version? And finally, when it's time to actually, you know, you're writing up your results, you're writing those papers, this is when you're preparing and curating your data. So we talk with a lot of people about that. What does it look like to de-identify data? Who's going to do this work? What other things do you need to think about in order to package data for sharing, as well as the actual process of sharing data in repositories? So, you know, what does that look like? How much time is that going to take? And if people are having issues with uploading their data, we do a lot of troubleshooting at this point as well. So we really do try and, you know, meet people where they are at any point of the research lifecycle when they have these kind of data management questions. Next slide. And so how do we actually do this? We provide support in a variety of different modes. So we have a lot of our kind of first level of attack is resources and guidance. So really ideally step-by-step guidance to meet everyone. We do a lot of education and outreach to provide more in-depth assistance as well as one-on-one consultations. Next slide. So when it comes to resources and guidance, here the goal is really to translate often complex and dense policy language into easy step-by-step guidance. So I don't know if any of you dived into the NIH guidance behind some of these policies, but there's a lot in there. And so we want to ideally make that as easy to implement as possible. And this often requires a lot of behind the scenes coordinating with other departments within UCSF to make sure that we all understand what the guidance is supposed to be and that our messages are aligned so that we can connect people to the right office. So I put some examples here. You're welcome to click on these when you get the slides, but the one I wanted to highlight the most is that for this new policy, we've created kind of a one-stop shop page. So this is where we have links to the sample plans that we've created here at UCSF, as well as other templates, the example plans from NIH, which if you haven't checked those out, I highly suggest you do, as well as FAQs. So lots of questions that we've been seeing and some of the answers we have for those. And then other resources we put together for data management in general. We have a guide to reproducible data management, as well as a guide to sharing data in repositories, which is a more kind of step-by-step, you know, what are all the things you need to consider to prepare your data for sharing. Next slide. When it comes to education and outreach, we do a lot of kind of ongoing training and education. So the last couple of months has been a lot of monthly virtual workshops on this new policy. I also teach, as part of our Responsible Conduct of Research course, a data management session for our graduate students and postdocs. And lately have been doing a lot of customized in-depth training and workshops. So these are generally by request of a specific department or team. So I did one on how do you share qualitative data. So some of the considerations around preparing and sharing qualitative data. This was co-hosted with our IRB office. A couple different sessions on that are NIH Institute specific guidance. As Jaron mentioned, NIDDK does not have its own policy. They just have very helpful resources, but some other institutes do have their own policies, including the National Institute of Mental Health. So that one is very robust and has required quite a bit of training to prepare folks for that institute. As well as how do you think about data sharing for sensitive research topics? Maybe some areas where making data public could put participants at risk, and how do you handle that? And then a lot of outreach. So in addition to these workshops, just really kind of trying to flood the zone with information about this new policy. So that looks like monthly news items in our library newsletter, as well as our UCSF-wide research emails. And as I mentioned, lots of presentations. So I presented at over 40 faculty and departmental meetings and grand rounds to just get the word out about this new policy and make sure that people knew of the resources that we've put together. Next slide. And finally, for those that need more kind of in-depth support or hands-on support, we do a free one-on-one consultation. So lots of the topics that have been coming up recently are around, which repository is relevant to my data, to my project, and costs as well. And I often point people, once we know a repository, repositories can often be really helpful in understanding the costs associated with data sharing, as well as finding a relevant metadata standard. So in these questions, I think we saw in Lisa's survey results, sometimes these require referrals to other team members. So for example, when someone comes to me to ask about informed consent, I can connect them with our IRB office, which has some great consent templates. When we're starting to talk about, sharing data in a repository that requires data use agreements, that's not something the library can facilitate, but our industry contracts is the group that can sign those agreements. So we really do this emphasis on kind of connecting with other groups on campus. Next slide. And that's just kind of one of the main things we try to do as librarians is we don't always know the answer, but we generally know who does. And so our goal is really to help our researchers navigate sometimes complex research bureaucracy at UCSF. And I imagine that at your campuses, it is also sometimes complex. So we try to work really closely with a variety of different groups on our across campus. Next slide. So finally, just to emphasize some knowledge gaps that we're seeing and how librarians can help. So I'm seeing a lot of folks struggle with just in general kind of understanding this new policy. What's required? What do I have to do? What do I have to do now versus later when it's actually time to share? Choosing an appropriate data repository, and it's really great that NIDDK has some very step-by-step guidance. I looked at their whole little workflow. It's very cool. And finally, just understanding costs as well as the kind of work and time associated with data management. And I will say, I think this is an area where there are some gaps in terms of NIH guidance, and I'm hoping that we will see more kind of concrete examples coming out in the next couple of months. So finally, if you have these kinds of questions, I really emphasize checking with your local data librarian to see, is there guidance that's specific from your campus? So we have, in addition to kind of the general NIH stuff, we've also put together some specific guidance for UCSF investigators. So check and see if that's something that's also available on your campus. Is there somebody that can provide hands-on data curation? So Lisa was talking about that data curation network. That's fabulous. If there's someone on your campus that does that work, that is a great resource. And finally, is there somebody that you can meet with to ask questions about your plan? I assume, or I predict that there is. So I would definitely take a look and see if there is somebody locally at your institution that has done work similar to the work that we've been doing at UCSF. All right, and I think that is it. Do I have one more slide? No. All right, so I think that's it. So I think we're going to go into our question and answer now.
Yes, so I'd like to invite all the speakers to turn back on their video, take a sip of water, and get ready for the question and answer. Apologies for the technical mishap earlier, but as I was trying to mentioned to the team, we will be collecting all of the questions that are shared today. And even if we don't have time to get to answer your question here during the webinar, we'll be compiling questions and putting those as part of the FAQ. And then I do have a convenient conclusion slide with contact information that I will put up towards the end. And so I think we can go ahead and start with the Q&A. And this asks, can you give an example of a total cost of DMS for a clinical study with human subjects, just so that we can engage in further conversation? So I think just kind of thinking more generally about the cost aspect of the DMS budget, which I know Jaron covered in his presentation. Would you like to say a couple words about that, Jaron?
Yeah, absolutely. Thanks, Michelle. And thanks for the questions. So this is a very tricky area, and that we know that the total costs that are associated with the trial or the clinical study will just differ based on the study, the extent, the outcomes, and those types of things. And so it's really hard to provide like a total cost, but we do know that there are common elements that would be involved in a clinical study that would be appropriate for including in a data management and sharing budget. So for instance, being able to access a standardized collection form or instrument in order to collect that data similarly to the way that others are doing it, it really increases its interoperability of the data. Also, we know that clinical information is very sensitive and that de-identification of that data will be required. So looking at opportunities for de-identifying the data to make it as available as possible are costs that can be included in that budget. In addition, we know that this data may be very sensitive and require the controlled access to the data. So being able to format the data in an appropriate way to deposit it in a repository which can support that, that type of controlled access will be required. So there are a number of features that can really be built into that are very common. But just providing a total cost is a tricky question because of the number of variables that really factor into that. But hopefully that gives you an idea of some of the things that would definitely be appropriate for a clinical study to include in their budget.
Yes. So our next question is for Lisa and Ariel, the librarians. And they ask, is it advisable for principal investigators or PIs to first consult their institution to determine if they have the necessary capacity and expertise of a librarian to assist with data sharing? One additional note, PIs can request support and outsource assistance for their data sharing efforts.
Yeah, so I can just start by saying, yes, definitely check at your institution. I think there have been some instances where researchers just sort of like made the assumption that the library would be able to help and put that in their plan, which you don't want to just assume. Certainly, see who has the relevant expertise at your institution. And yes, it is, absolutely possible to get the librarians involved. There was another question that I answered in the chat about actually having funding for librarians. And if you are asking your institution's librarian to have a more involved sort of role in your project, certainly appropriate to include them in funding for your work.
Yeah, definitely. And I think the emphasis on just reaching out to the library early and seeing like what support can they provide, what do they have the capacity to do? Because locally here at UCSF, like I'm really a team, I have a team, but I'm the data person, the data management person. So I cannot be doing hands-on data curation for everyone. So my role is really more high level, like helping connect you to resources and guidance. But other institutions I know of have a huge team of data curators, and they do a lot more of that kind of hands-on work. So just being kind of aware of like what's available locally, and then what percentage is the librarian going to help with versus maybe connecting you with other groups on campus, or, connecting you with other more hands-on support elsewhere.
Thank you. We have an audience member asking, can you give some detailed, concrete examples, besides stating that the data are confidential, of what data should not go public? Jaron, I believe you covered this in your presentation.
Yeah, so the NIH has really emphasized this as well, because we know that it is a major concern. There is specific data types that are rather sensitive. There is additional policies on the use of tribal and American Indian and Alaskan Native data. There is considerations there that need to be factored in, and so the data itself, really depends on how broadly it can be shared, the features of it. I would encourage everyone to take a look over at the notices that have come out, and the NIH webinar that they had. There was a two-part webinar, and the second covered a lot of those data privacy concerns, and I'll supply those links here in just a second in the chat.
Right, and we can share them afterwards via email as well. Ariel?
Yeah, I was just going to say that one of the tools that I look at there, I was trying to find the exact link to the FAQs, but there's a list of kind of data types that are justifiable not to share, and that's the conversation I generally have with people. So, for example, I mentioned I was talking with doing outreach to kind of sensitive data. In this case, it was folks who are working with abortion data, and they were like, this data is about people who are doing activities that are potentially illegal in some states, and so that even de-identified could potentially put people at risk, and that's one of the reasons it's listed as a justifiable reason not to share. So if your data, by sharing it, is putting participants at risk, that's not something you want to make public, and that's something that if any of these things apply to you, you still need to submit the plan, but then you would describe, we're not going to be making this public because it is potentially going to put people at risk in your plan. So I think I can ferret that out and put it in the chat.
Yeah, and I would also add there, I saw another question about, businesses that are generating data with intellectual property. And in those cases, there are specific instances there, those research opportunities are still subject to the DMS plan, except for that those particular types of funding mechanisms have, a period where they can withhold the data for 20 years. And so that may be another opportunity. There may be instances where there's, contractual obligations with collaborators or business partners that may prohibit that. And so we know that we want the data to be shared as widely as possible. We should be looking for opportunities to share the data, but in some cases there are those instances where there's either ethical, technical, or intellectual property considerations that would limit that data sharing.
And for one final question, I'll direct toward Lisa in our last minute here. How is the NIH supporting institutional librarians so that they can engage more effectively with researchers?
Primarily through training and providing opportunities for them to gain skills and expertise. The network of the National Library of Medicine does offer some small grant funding that librarians could pursue for specific activities. So those are some things I would say that that we are doing, especially through the NCDS that I mentioned.
Great, and I'm going to put up our conclusion slide with the email address for any follow-up questions as well. Now I know that people will be signing off. Wrong share. And so we wish you well on the rest of your workday, and we hope that you'll come back next month for our second webinar, which deals specifically with finding a repository for your data. Okay. And so I'd like to thank our panelists for today, and we will follow up soon with an email to the participants with resources.